So this short screencast is meant to be an appendix to the literature that, or the lecture that I gave at the PMRC course on health research, and it's not meant to make you an expert in sampling, randomization, and so on within 10 minutes. But again, it's meant to provide you with an overview. So in 6 months' time, where you have to decide on how you want to sample your patients, how you want to randomize and blind, then you can go back to the screencast to get a really, really quick overview of these methods. So of course, when we talk about research and we want to study, for example, knee osteoarthritis, we can't study all older adults with knee osteoarthritis. Somehow we want to study a sample of them. That could be a 50, that could be 100. And based on them, we want to make some inferences that apply to the entire population of older adults with knee pain. But in order for that to be possible, then we need to make sure that the way that we sample is reflective of the entire population. That means we should include subjects, somehow sample them randomly from a background population, because first then will that make these statistical inferences possible. And overall, we have two different types of samples. We have these non-probability samples, and that's what you would normally say as a convenience sample. When you ask around your department and the 10 closest PhD students, that's the ones you want to include in your research. That's non-probability samples. They're chosen by you. But probability samples, I admit that this is a bit larger, because this is what you should aim for. And you should really put in some effort into probability samples. And there's different ways or methods that's used in probability samples. In some is simple random sampling, systematic sampling, stratified, multi-state sampling, and cluster sampling. And when you want to decide on how you want to sample, then you should think about who are you actually studying. Who would you like to make inferences about? As an example, if you want to study older adults with osteoarthritis, do you want to make inferences about the entire population, meaning everybody in the background population? Then, of course, you should use some kind of sampling in a background population, maybe by the CPR number, something like that. But if you want to be able to infer something about the population of older adults with knee osteoarthritis that is seen in your department at the hospital, then of course you need to sample them from the department. That could be through the waiting list, where you would pick every second, every third, or random numbers. Then you would be able to infer something about the population that is seen in your department. So the main point here is, when you need to decide on how you want to sample your patient, you should think about who do you want to make statistical inferences about. Is it older adults with knee osteoarthritis in your department, or is it the entire population of older adults with knee osteoarthritis? That's something you have to think about. And then of course the question is, when you start to recruit these older adults with knee osteoarthritis, do you need to blind them? Meaning, do you need to hold information from them on the actual purpose of the study? Do you want to blind them towards your intervention? Do you need to blind those that make the data analyses? And this is really, really important to think about already when you're writing your protocol for the study is to think about who can actually introduce bias into my study. Could it be the subjects? Because if they know they're getting the new drug, the good pill, would that create some kind of positive performance bias, and then they would rate their pain even better because they think they're in the new intervention group? If that's the case, then you need to do everything you can to blind the participants. But what about maybe the doctors or the physios who recruit the patients? Do you also need to blind them? And what about those that collect the outcomes? Should you also blind them? So you need to think about who can actually introduce bias into my study, and then you need to blind every one of them as good as you can. It's not always easy, and sometimes it's not possible to blind those delivering an intervention if the intervention is exercise therapy. And of course, you couldn't blind subjects if they're receiving exercise therapy in 2 different doses. They would know that they actually receive exercise therapy. The point here is that you should avoid single blind, double blind, triple blind. You can't only write that. You also need to state who is actually blind. So single blind, is that the outcome assessors? Is it the patient or the MDs that recruit them? You have to be specific. The best ways, if you want an overview on how you could report the blinding in your clinical trial, this study by Asbjørn Robertsen, a couple of years old, but it provides a really, really nice overview about the description of who was blinded, and then also how was the blinding actually implemented. So take a look at this study. When you need to, already in your trial protocol, when you have to write who was actually blind and how did you implement it, take a look at this study for ideas on how you could report it. And then when you've decided on how to blind subjects, the next step could be the randomization procedure itself. And this is a really, really critical step when you're doing a randomized controlled trial. It's not just about flipping a coin. This is a principal bias reducing technique where chance rather than choice will eliminate selection bias. And the success depends on basically 2 related items. And one is the sequence generation, where you need to make an unpredictable allocation sequence based on some kind of random procedure. When you've done that, then you need to do allocation concealment, which is a strict implementation of that schedule. And you need to secure that you do it and prevent any foreknowledge of treatment assignment. So basically, you want to avoid that the person who recruit a certain subject, an older adult with knee OA, knows that this subject will end up in the new intervention group. You have to be really, really careful and prevent foreknowledge of treatment assignment. And this is not easy. And if you're ever in doubt, I would always consult a statistician or other personnel that has profound experience with the different ways on how to randomize, because it's not an easy task. And there's a lot of different ways, some more advanced than others, on how you can actually do the randomization sequence. One of the approaches we've used previously is the blocked randomization, where we've used different block sizes. So that could be for example, blocks of, let's say, 4. Then you could have a block of 6, and of course, those that are actually randomizing patients wouldn't know these different block sizes. And then based on, it could be patient 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then within these blocks, you would randomize them to either maybe intervention or control in a random order that nobody knows. But the point is that within this block of 4, there would be 2 that would go to control and 2 towards intervention. And the same way here, you would have a block size of 6. You would have 3 that would go to control and 3 that would go to intervention. And then you would vary these block sizes between maybe all the way from 4 and up to maybe 12 or even higher, depending on the sample size of your study. But as I mentioned before, ask a statistician, ask someone that's experienced within these different different ways of randomization. So the main message is that when you consider recruitment and sampling, you have to think about, who do I want to study? Who do I want to make statistical inferences about after my trial? And this is really, really important. And blinding, think about blinding all those that might induce bias into your trial. And of course, it's not always possible to blind, for example, subjects if you're delivering some kind of exercise intervention, but blind them as much as possible. When you need to randomize subjects, then successful randomization depends on 2 interrelated items. One is the sequence generation, and the other one is allocation concealment. Basically, how are you implementing your sequence generation to prevent any knowledge of upcoming events? And this is really, really important. And an advice is to keep the randomization as simple as possible, and always bring in a statistician or someone similar that have experience with randomization before you decide on how you want to randomize. Because randomization it's not just about flipping a coin. There's so much more to it, and you need to bring in expertise before you decide on how you will actually do it.